Assalamu alaikum, friends. Namaskar, dosto. Good evening. I'm Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. This is our non-stop show's 889th episode. We are going strong. We hope to reach 1,000 soon. Let's have the headlines for today. Now, studies have shown that if you have a heart blockage, if you have heart disease, the chances of blockage in peripheral arteries are more. तो यदि किसी को हार्ट की बीमारी है तो पेरिफेरल आर्टरीज में भी दिक्कत आ सकती है. According to a pooled data analysis of current evidence, fibromyalgia. Now, fibromyalgia is a very common disease. We should discuss this sometime. This is a disorder that produces persistent, widespread pain as well as tiredness. This is associated with an increased risk of mortality. So don't ignore this. Do go to your doctor if you have symptoms of fibromyalgia. The good news is that an experimental drug for Alzheimer's disease is when you sort of begin to forget things and you don't even know that you're forgetting things. An experimental drug produced by Acumen Pharmaceuticals has passed an early safety test and it will progress to further trials now. This is good news because Alzheimer's disease, dementia, is increasing across the world. Studies have shown that focusing on immune response helps us in handling neuropathic pain. Now, neuropathic pain is a disease which is difficult to handle. All doctors in diabetes and neurology will tell you it's very challenging. And we have new approaches now, immune-based approaches, which will help us help our patients. And then researchers have found out that time perception has been strongly linked to neural activity in the brain structure that coordinates physical movement. So the same part of the brain that coordinates physical movement also helps us understand time. With this, let's go to our topic for today. But now our topic is special, so let's have a special zing to it. Faraz is with us backstage. Faraz, would you like to show us a video, please? What's special about today's KK Med Talks? This is exciting. It looks nice. Now, what is IFM, I wonder? International Family Medicine. Now, if we are all interested, if we are piqued, we need to know what this is. Let's find the expert for this, an international expert. And for me, it's a great pleasure to be able to welcome a doctor from our brotherly country. Warm welcome, Dr. Ibtesam AlBastaki. Madam is Arab Board certified. She is Director Investment and Director Public Health Partnership Department, Dubai Health Authority, based in Dubai, United Arab Emirates. She is also handling the responsibility of the Scientific Committee Chairperson, and I know how difficult this work is to do. She is the Chairperson for the Scientific Committee for the International Family Medicine Conference and Exhibition to be held at Dubai later this year. Warm welcome, Madam.
Thank you very much. Thank you for having me this evening and to be part of your platform as well.
We are happy to have you, madam, because the work that you do is known not only in Dubai or not only in the United Arab Emirates or the Gulf, it is known far beyond that. And we have people logged in from all across the world. We have Dr. Vipin Bandula, who is a civil surgeon. He runs the district health services in Kangra in Himachal Pradesh, a very beautiful part of the Himalayas. We have Dr. Ramesh Pal Singh Pawar. Sir is 72 years young. He recently returned from the USA. He's a pediatrician. We have Dr. V.K. Goyal and Bimla Kapoor madam as well, and other people have also joined in. Now, there is so much to learn from each other. Dr. Talha is a psychiatrist from Roorkee. He has joined us. When we look at the trajectory of UAE and Dubai, when we became independent, at that time, UAE did not have very good health markers. The quality of health was not good. But today, what UAE has been able to do, what Dubai has been able to do, you have excellent health for your citizens, and you are also a health destination. You are a medical tourism destination, a wellness tourism destination. So we'd like to learn how you manage that. But first of all, would you like to tell us about your background? How did you reach family medicine?
Okay, that's a quite long journey when I reached to family medicine because I graduated from Royal College of Surgeon in Dublin, Ireland, and then I was working in the hospitals and I was very much confused between internal medicine and family medicine. And I did honestly a bit of my career path into internal medicine. And then I decided I wanted to be more exposed to pediatric mental health, how I can support more my community. So therefore, I have selected to join the family medicine residency program, where I have obtained my Arab board in family medicine. And from there, I got even very much excited. I looked at the occupational health. I looked at the aviation medicine. I got my certification in aviation medicine from Monash University, Australia, in Melbourne. And then, and slowly I was even dragged towards some leadership jobs. And I basically loved changing the whole system and how basically we can cater our community in terms of how we can make it more accessible, physical and financial, not only to national, but even to the residents and people who are staying in Dubai and in UAE. So therefore, I did even my master degree in health management, where I looked at it from different angles and how I can make the health system more cost effective to the people and to the government sectors. So we have, it was a very long journey, but honestly, in every steps, we learned so much. And I hope that whatever we did, it's actually giving back to our people.
Many things, ma'am, coming out of what you have said. What I'm impressed is all the people who have logged in, especially all the younger doctors and the ladies. You are a source of inspiration. So this is from our Hindi language. Your feet are on the ground, but that doesn't prevent you from reaching for the skies. You are grounded
True.
in your community. Community is our strength, and you are still able to do aviation medicine and also management.
Yes, I did. I worked in the Dubai airport for almost 4 years as well, where I set up all the healthcare policies and standard to cater the passengers as well as the staff of the airport. Because in Dubai, Terminal 3 and Terminal 1 is the
You,
city of a city, city in
yes.
a city. So it's a huge population, a lot of people moving around. So you have to put all the right measurement to ensure that it's being controlled and up to a standard. And especially we had a different outbreak and pandemic going on, and we are all aware how basically UAE has handled it, and things went smooth. And now we are back to the normal. Things are open to everyone after having a strict healthcare measurements there.
So many things that you're doing, and what comes across strongly is your use of the word community. Now, Ibn Sina, uh, the famous physician of ancient times, medieval times, he also said that the individual can be only as healthy as his community or as her environment. So if the community is not healthy, if the environment is not healthy, you can take the maximum medicines that you want. You can do all the tests, you can take all the medicines, get all the surgeries done. Still, you will not be healthy. Is this true, especially from a South Asian and an Arab perspective? Is it true that we are more community oriented in Africa, in the Middle East, in Asia, and that is why we need to focus more on community medicine, family medicine?
Absolutely, because if you look at it, family medicine is not only the GP who are the gatekeeper for the people. They treat the patient as well as their family. So they ensure the whole family in a good health and practicing the right way of this is one of the things that most of the family physicians are trying to do. And then, of course, there is a cultural aspect, social aspect to it as well. So therefore, the way they are practicing family medicine is not only patient-centric, but they're focusing very much on continuity of care. And that will allow to have a proper accessibility between the patient, family physician, and other specialty based on the problems that's been raised by the patient, him or herself. The other point which I really want to raise, and I think it's very crucial, it's very important. I mean, treatment and diagnosis is one aspect, but there is a step before that I think most of the family physicians are encouraging and increasing the awareness because they work very much closely with the public health experts. They want to do a proper screening program, and I always say that's my always talk to in any conference I participated, that if we don't have a prevention methods and screening programs in place, we will not achieve a healthy aging populations where it could be a cost effective to the people as well as to the government and to every single individual. So no one wants to fall sick, and if they want to fall sick, they want to fall sick in a way it shouldn't be complex to the patient, and patient should not suffer. So therefore, doing a very early screening and early steps of the prevention will help a lot of community. Now things are changing, which I can speak for a whole day, that people are changing in terms of their lifestyle, the habit of eating and the habit of doing the exercising. So even that's part of the whole program, where the emphasis should come from the family medicine as well as from the patient and patient awareness and education.
Dr. Vipin Vandula also points out that actually the family physician has the toughest job out of all the doctors, because the family physician has to be well versed in medicine, ortho, gynae, surgery, community medicine, pediatrics, and most important of all, the family physician has to be well versed in psychology and psychiatry to make sure that these behavioral changes occur.
Absolutely, I 100% agree, because we are not only treating physical. When you go as per the WHO definition, it's a mental, physical, and social aspects to it. So therefore, you have to, once you call that this person is healthy, you're talking about physical healthiness as well as mental, as well as the social. So once you have that parameters are intact, then yes, you are actually fulfilling the definitions of the WHO. So when I focus on physical aspects, I mean, I include mental health always, because that will be another issue in future. And if we don't focus from now and we don't build an infrastructure for it, it will be a big problem that we might face in near future.
Prevention is better than cure. There are many proverbs for this. Penny wise, pound foolish, stitch in time saves nine. In Urdu language, we have this statement, madam, paise bachao, save paisas, asharfi lutao. Asharfi is the same in Hindi and Urdu and Arabic. Asharfi means gold coin. So the equivalent would be you save in Indian rupees or Pakistani rupees, and you end up spending in UAE dirhams or maybe Kuwaiti dinars if you don't take care of your health in the right at the right time.
Absolutely. That's a perfect example.
And the UAE dirhams may still be affordable. The Kuwaiti dinars will not be affordable at all.
Absolutely, 100%. Yeah, exactly. What you have mentioned is absolutely correct because it's very important. Now, by 2030, what WHO even mentioned that 80% of countries will have kind of a system in place for mental health. But mental health issues has been increased for past decade. So it's around 13 or 15%. And we do have every 4 kids out of 10, if you look at the adolescents as per the CDC, that they suffer from any kind of mental pain. And 29 or 30%, they really suffered kind of like a mental problems such as depression and so on in adolescents. So if we don't target these issues, therefore it will be a burden on all of us. And that's why in the International Family Medicine, every year I bring in experts to educate our family physicians in regards to the mental health and various mental health. And this year will be a very exciting one because we are engaging the part of the technology and its pros and cons to it and how it's impacting the mental status of a person.
And people always complain that modern technology is spoiling our health, but we can use it in a positive manner as well.
Absolutely, absolutely.
Madam, we have spoken of mental ill health. What are the other major problems that we face in the UAE and in the Gulf? What are the major healthcare challenges that we have now?
Of course, chronic disease is a major one. Cardiovascular, it's a top killer in UAE as well as in GCC country, and that's why you have seen my title, investment and PPP. So I'm doing the first PPP projects with Dubai government and the private sector for the cardiology center of excellence, and it will be in a state of art. Hopefully we could finish the contract this year, and the kickoff will be hopefully by end of this year or by first quarter of next year. So it depends how the project is moving, and that's the reason, because it's the first killer of or more high mortality rate of cardiovascular. This is the main issues that we are facing over here. And second one is the oncology, and cancer will be a problem. And if we don't do a proper screening, honestly, we're going to causing a lot of increase in the numbers of those cancer. The main I would list the 4 cancer which is exist in the country. Breast cancer is number 1, colorectal cancer, lung cancer because of smoking, and of course prostate and some of the gynae cancers. It's considered to be on number 4th and 5th. So these are the cancer that we face them. So I think it is the time that we need to focus a lot on the prevention methods, which we are doing in terms of breast cancer and colorectal cancers. And we do even we have mentioned a couple of times in our program about the screening programs for the patient when it comes to the colorectal for FET test and colonoscopy and so on, as well, and breast cancer, when to do the mammogram, when to do the ultrasound, at what age. And we as a UAE, we do the colorectal screening at a very early age, at age of 40 and above. And that's even covered by our insurance scheme. And that's because, a lot of patients has presented to us at a very early stage. So we do have such a program set in place. However, we need to do a lot in terms of increasing awareness for the patient when it comes to the smoking and so on.
So we see the important challenges that are being faced. First is M for mental health. The second is M for metabolic health. Metabolic will include cardiac disease, diabetes, obesity, everything put together. And then the third M is malignancy or mitogenic issues. So these are the 3 challenges that we face.
Absolutely.
One nice thing, ma'am, that comes across is that the challenges are there, but we are not shying away from them. It's not that we are getting afraid and we are refusing to fight. We are gearing up to handle these challenges. As life changes, as the human life environment changes, we are also gearing up to change the healthcare ecosystem. Dr. Vipin Bandula points out that India has various challenges, and the Ayushman Bharat. Ayushman means long life, may you live long. the Longevity Bharat or the Long Life India digital mission has been started. And multiple healthcare workers from the primary level, the auxiliary nurses, the midwives, community health workers, ASHA workers, they all put together to screen patients for disease, and they try to promote preventive care, promotive care. How is the system geared in the UAE? What are the visions of the government? And how is the primary healthcare system
Okay.
operating?
Yes, it's basically we do have a system of GP gatekeeper, but it's still a lot of community or a lot of our patients, whether it's national or non-national, they prefer directly go to the specialist. And the insurance still allow that, you know. So, but what we did lately, they need to go first to the GP at least as a first visit before they go to the specialist, and then they can have an access to the hospital's polyclinic or any where they feel comfortable to be assigned to it. So this is actually, I would say, you know, we were trying to blend kind of a system between UK and other countries. But GP gatekeeper is the best way to do, because you know each GP will be assigned to certain families, and they will understand the whole structure of each family and what kind of diseases are there, including the genetics issues. Because one of the, you know, you mentioned the malignancies, it could be genetics. I mean, if you understand the whole family histories, it is easier than when to do such an X-ray screening and at what age you need to do such a screening. We have a very good insurance scheme set up for in Dubai. So 25% is the government insurance, the rest is the private insurance, because you have a huge private sector when you compare it to the public sectors. And similarly, and when it comes to the healthcare provider, you have 80% of the outpatient and inpatients are run by the private clinics and private hospitals, while 20-25% run by the government sectors. So the government has given the authority and the full supportive to the private sector to come in our market to cater and create a healthy competition among the rest of existing healthcare government services. And this will give even option to the patients where to go. And then you create even a proper kind of like a knowledge transfer between the public and the private sectors, where even they can learn from each other. So we do have physician working in government sector, as well as they do their other clinics or surgery in the private sector based on their patients and patients insurance. So that's kind of a method was working quite well, and people quite happy. They're not complaining much. Of course, the complaints will come whenever there is the services which is not covered by the insurance, and that's mainly is dental and cosmetic, which is, you know, something not an
Necessity.
critical or essential
Yes.
problem for the patient. So this is the way it's really run the healthcare system over here. And the government is still encouraging the partnership between the public and the private sector, and that's to empower the private sector. And as I mentioned, to bring the know-how and the knowledge transfer, whether it's at the service or operational level, or at the technology and innovation level.
So, very good things coming out. In the same sentence, you use the word competition, but you also use the word collaboration, connection. And I think
Yes.
that is the beauty. The way government has been able to build an infrastructure where people collaborate with each other for the benefit of all. And the
Yes.
different options that you said, that is something very nice. In Indian political philosophy, madam, we have the word sarvodaya. Sarvodaya means benefit for all. There would be an Arabic translation. And then we have another word, antyodaya. Ant means at the end. Benefit to the last person in the queue, maybe the poorest of poor. So what I hear is that the government's vision in Dubai is that there should be sarvodaya, benefit for everybody, and also Antyodaya, benefit for the last person in the queue together, so nobody gets missed out.
Yes, absolutely. If you come to the, say, emergency, because see, most of the trauma issues is run by the government sector, and that's because it's subsidized by government. So if you look at it, and that's why any accident or any emergency is usually goes to the government hospitals. Now, it doesn't matter where you are at the top of the pyramid or at the bottom of the pyramid. So it will definitely will go there and be treated there and treat everyone equally. So that's the beauty of it. The other thing, it's now when it comes to the continuity of care, they have an options. And what's nice about the private sector, they even having a different level of care. Let me tell you in other words, the quality of care is the same, but they can cater different level of populations or different segment of population, I would say. So they build up a hospital who can give the same quality of care, but because they don't have fancy rooms, and that's basically can cater the lower levels. So and that's what we appreciated when the private sector came up with such an idea. Let's say, for example, somebody who is resident in Dubai and he can afford and he wants to stay in a luxury rooms, that's even available. So it's available, and you will see even a lot of national, because some of the hospital who cater the low segment and they see a lot of populations, you will see a lot of nationals go to that hospital as well, because they trust the doctor based on the high volume. Okay,
Yes.
and that's why, you know, the repetition of these hospitals sometimes is way better than any other ones.
Yeah, because the doctors are more experienced.
Absolutely.
This is known as health equity. So thank you, madam, for teaching that as well. There will always be inequality in the world, but the Dubai government is able to create health equity. Everybody will get the same kind of treatment in case they have an emergency, health emergency, an accident or anything. And pharmaco equity means you might change the room. It can be a 5-star room or a 7-star room that you are staying in, but the drugs, the management, that will be the same for everyone.
Absolutely. Exactly what you have mentioned. And everyone in Dubai is 100%, I would say 99.9% are health insured. So they have an accessibility to their hospitals, no matter what kind of insurance they have, but they have an insurance. So there shouldn't be a problem from the financial perspective. There are co-payment, but it's quite minimal and is small, and it depends on what kind of a services they are looking for.
Dr. Vipin Bhandula points out that in his state, in Himachal Pradesh, HimCare cards are available. They allow everyone to access the
Yeah.
government system. And he also says that at the primary care level, they have screening, early diagnosis and management of cancers. And also the nurses and the doctors are trained in offering lifestyle modification for diabetes, hypertension, also for pre-diabetes and pre-hypertension.
Yes.
Continuing with this, Dr. Arbinder Singhal, he is a famous pediatric surgeon from Mumbai. He works in Mumbai, India, and also in the GCC countries. He thanks you for your comments, madam, and for your views. And he especially likes the concept about health equity, the fact that you are able to offer the same quality of health to all nationals and all expatriates. His question is, I run a digital therapeutics company, which helps people with diabetes and obesity achieve better outcomes. Is there an intent from the UAE government or from the Dubai government to use such technologies, digital technology, for the benefit of doctors and patients, especially in diabetes and obesity?
Yes, indeed. I mean, in 2019, even before COVID outbreak, His Highness Sheikh Mohammed bin Rashid, the Prime Minister, and he actually announced the 50th Charter, where he emphasized that every single individual in Dubai should have an accessible to the healthcare system. And of course, without technology, you cannot do that, because you know the limitation of resources in healthcare sector. So what we did as a Dubai Health Authority, priority, the licensing team, they started to build up a standard for telehealth and teleconsultations. So therefore, a lot of companies, they came in to and engage for having a consultations through telemedicine, which is cheaper, more accessible, easier, and you don't need, especially people have a limitation to transfer or to move around, so they could have an access to those services. So it was very kind of beneficial, especially at the primary healthcare level, and as well at the even there was a telemedicine catering laborer and labor camps in their languages. As well, there was a teleconsultations for chronic disease for different segment of populations. So this is available. There is a system. And when we've been hit by the COVID-19 outbreak, so that's, I mean, because we had a system in place, that has helped us a lot. And that, therefore, we never had a problem in looking after our patient, especially chronic disease patient who are having either asthma, diabetes. Asthma and diabetes is a most common one. Of course, hypertensive hyperlipidemia, it comes along with diabetes as well. So, and as well as some complex cases, people who've been on chemotherapies and so on, and how to manage those things during COVID-19 when there was a lockdown. I think teleconsultation has helped them a lot. Now we are going on a even a step above that. We are trying to bring a system where we can do a second consultation. Of course, you need to have kind of like an accessibility and approval and security, because at the end it's a patient data and patient security. And of course, on the other aspect, a lot of surgeons, they are now even moving out.
So Madam is back with us, yes. Perhaps we need to unmute, Madam, perhaps. Perhaps we need to unmute. Dr. Ibtesam, we lost you for a minute. Can you unmute yourself, please? Yeah, is it okay now? Can you speak? No, not working. We have Faraz with us backstage. Faraz, would you help Madam out? Yeah, now can you try? I think we need to check the microphone settings. But Madam's point was very well taken, that teleconsultation is okay. Ma'am, Faraz is requesting you to log out and then log in again. To log out and start all over again. Can you log out and then rejoin us? Because we cannot hear you. If you can log out of the program and then rejoin the same link. So these are some of the challenges that we face. Yeah. So these are some of the challenges that we face. I think now we should be able to hear you. So actually there are challenges. Even with the best of technology, you can get in trouble sometimes. But then that's what life is all about. Meeting challenges, overcoming them, and then meeting and overcoming them with a smile. So Madam should be back with us. So many things that we are learning. The UAE also has challenges, but they are able to sort of overcome these challenges. They have a very proactive approach, a very futuristic approach. And this concept of public-private partnerships is something that we see in India as well. Our government hospitals are using technology. Like Dr. Bandula says, PGI doctors and AIMS doctors also offer teleconsultation. Online registration, online appointments have become the routine now, and that makes things easier for everyone. We are joined by Madam Neena Aggi from Karnal, leading socialite. Thank you, Madam, for joining us. And Vinayak Sharma ji is also with us. While we wait for Madam to come back, let's continue our discussion. Welcome, Gurvinder Kaur ji. The topic is family medicine, public-private partnership, how to get the best out of life. And any examples that you have, whether it is Dr. Bandula from management perspective, how can we create effective public-private partnerships? Or from a patient's perspective, how are we able to navigate? For some things, we go to the private sector. For other things, we go to the public sector. How can we ensure that there is good communication between the doctors? Welcome back, madam.
Thank you. Sorry, I got lost.
No, that's perfect. We were speaking about resilience and the fact that there will always be challenges in life, but you have to meet them with a smile. Yeah.
Absolutely. Yeah, ask me about the challenges when it comes to different projects and different policy and, whenever you want to implement something and, people's at the end, they come with various suggestion and opinion. So therefore, it's not easy sometimes. You have to be quite strong enough how to deal with different issues.
My daughter is logged in, madam. She's a graduate, an MBBS graduate, and she's very much impressed by the way you are handling so many things together. So her question is, she's 23 years now, and she's planning to choose her post-graduation, her specialization. Her question is, madam, how do you handle all the difficult people around you?
Oh my
As
God.
a lady doctor, what advice would you give her?
Well, see, honestly speaking, you need to focus in your life. I mean, there is a lot of bumps, you go through it, but you should ignore and you should focus what you want to do and just keep going. Just keep going. I know it's sometimes it's very difficult. I mean, we dream a lot and we want to achieve things even quickly or very fast. And we always think that things are easy and can be done, but it's not really. It has a lot of bumps. It's a stair you need to climb, and sometimes you need to fall, and that's not a shame, and you have to keep going on. I have fallen many times. I felt many times in my career and in my life, but I kept going on. And of course, you should make a good relationship with every single individual. Whether it's, I mean, I even have a good time with my porter or teammate, the T-boys or anyone in my organization. So I always keep smiling, helping, supporting, and this is the way you leave a great, I would say, stamp in every single step that you will take it in your career. So I think this is what I will advise her, and just keep going, focus on what you want, and just move and reach your target.
Thank you, madam. These were really good words of inspiration. Kriti is in Hyderabad right now, my daughter, and Khyati, my niece, she's in Kolhapur, that is in Maharashtra state. So both of them thanking you. And I'm sure everybody else who is listening to you also thanks you for your words.
Pleasure.
Madam, we
Thanks.
have spoken about the challenges that UAE and Dubai has faced. We have also spoken about what is going on, the vision of the government, the initiatives, a focus on prevention, proactive approach, a focus on private-public partnership, creating health equity for everybody, creating healthy competition. What are the future opportunities with regards to family medicine, with regards to specialized medicine?
Okay, now I have done a bit of work in capacity planning for the Emirates of Dubai, and you can access to it. It is a public information, and we did something called even investment guide. Part of investment guide, there is a chapter talking about the demand and supply, and what's basically we require from a Dubai perspective and our population perspective. What we've seen that we really need certain speciality will remain and will remain forever, because as the humans are will be existing in this world, and in this planet, we need those specialities, and those are like internal medicine, pediatric, general surgeries, OB/GYN, because it's this is the life, and this is what's going to happen. But what we found as well in when we were doing our capacity planning, we found that there is some gap in certain area. One of them is mental health. Because of a stigma, people were never ever were talking about it, and people never wanted to come in front. And we found that there was really a big gap in the market, from the facilities existing, from professionals and expertise, as well as from the support services, from nursing, psychologists, and occupational therapists, and so on. We found as well that rehab is missing. Okay, we do have a physiotherapy department, but we don't have a full-fledged rehab center where we look at it from different angles. So any patient, when they recover from disease, they should go to rehab center for better recovery, for better continuity of care, and you have to put that patient back to the community. I mean, he cannot stay the way he is. So he has to go back to community where he can practice his normal life. So this is something even we found there is basically missing. The third one, which we really emphasize, and we really need to focus on it, is the ambulatory care, and the primary healthcare in using some innovative technologies. This is something even we recommend a lot. And I mentioned earlier, we will face a challenge in future having low resources from nursing and doctors, whatsoever is your population, but still there will be low numbers on doctors and nurses, and this is something, a big challenge, honestly speaking, and there will be an opportunity once we encourage those or our population and using technologies in the primary healthcare or ambulatory care. This is something that will cater the population. And when you think a bit in a longer aspects, we really even want to speak about precision medicines. Tomorrow there will be a clinic, okay, and it's mainly very much precise to each individual. So that's something where the medicine is going towards that angle, because we are trying to create a special package for each individual, and depends on their diseases. And this is where you're talking about the longevities and aging process and healthy aging as well. And of course, we will be having a gap, and there might be an opportunities in genetics and genomes, and which is something even big. And I think it needs a lot of attention. And tomorrow, each individual will be treated, diagnosed, as per their genetic compositions. So this is something that I feel the medicine is moving that way, and this even will give a lot of people to think where they need to focus on and how things are going on. And technology will help us. I would always say technology will support us, but will never ever take the place of the human being, whether they are at the GP level or surgeon levels or a pediatrician level or OB/GYN levels.
So the manpower, the woman power will always be needed. And there will always be a shortage of good quality trained nurses, physiotherapists, pharmacists. Yeah. So if you are good at your work, there are many opportunities, and you should be able to leverage technology and advances in medical science. Like suppose in your subject, there is genetics, then you learn genetics. If there are new machines to be used in diabetes, in obesity, in rehabilitation, then you learn how to use those machines and you remain updated. Madam, many questions coming up from you. Dr. Altaf Chima is from Lahore in Pakistan. He sends you his adab, assalamu alaikum. And he mentions that family medicine is the backbone of any healthcare system, whether in South Asia or in the Gulf. Does the UAE government and does the Dubai government agree with this statement?
Of course. I will say it's the spine of human body when it comes to the family medicine. So imagine a human without the spine. He can't walk, he can't handle anything. Yes. So the spine of the medicine is the family medicine, because they're the frontliner. They're the one who are in front of everyone. before even taking the patients to a specialty clinic. They're the one who are see most of the patient. Now myself, I mean, I was practicing at one stage. Now I'm very much focusing on my leadership program and my leadership role. But still, I get so much call because I'm a physician. I've been practicing for many years. Still, I get calls from my friends, families, and everyone. They're asking for my, because I'd be the gatekeeper for them. So before I refer them to any subspecialty, if they require or something we can solve it or get out of it just through me and doing some kind of a diagnostic services, so.
And Dr. Vipin says that even in India, physical medical rehabilitation specialists are lacking, though we now have a postgraduate program. And that is what you mentioned. The long-term rehabilitation is needed. And as we go older, more and more geriatric medicine specialists will also be needed.
Yes. And that's why now we are young population. We are planning for the next 20, 30 years ahead to have a long-term care where geriatric medicine, long-term care, it's something that if you just look at my investment guide, where is the capacity planning chapter, it's clearly mentioned, even geriatric, it's one of the area that the governments needs to focus on, and not necessarily the government. The governments can make a standard and policy, and the private sector can invest and reimburse through the government sector. So this is something even it's required.
Dr. Talla has a question for you. Supposing somebody from Pakistan or from India wishes to practice in UAE as a psychiatrist, what examinations do they have to clear?
Well, of course, if they just go to DHA's website, because there is a certain standards and requirements they need to fulfill before they do their examinations. So just go to DHA's website at the licensing and regulation icon. They can find all the standards and what's requirement from examination they require or they need, so they can understand, read it, and apply for it. And of course, definitely there is a gap in the market, and they can, can find a good opportunities in this area and in this field.
So for everybody, DHA would be Dubai Health Authority. So
yes.
go to the website and
absolutely.
Specific question. We've mentioned the challenges that we face. Is substance abuse a big challenge in GCC countries? Substance abuse.
Yes. Basically, yes, it is. It's growing because of the, as I mentioned, when I mentioned mental health, I meant even substance abuse including to it. And that's why if you look at the statistics of CDC, when they mention 4 out of 10 in adolescents, they always feel they are unwell. And that's because of the technology and social medias, which is going around them, pressurize them for certain things and certain addiction. An addiction not necessary to be only substance abuse, it could be technology itself, so will make that person even, forbidden to be part of the their group or their community. So therefore, we do face a lot of issues when it comes to this. And substance abuse, of course, not only necessary to be drugs, it could be even smoking and other substance too. So it's because I mentioned mental health generally is a stigma. Now people started to talk about it. They want to come in front because they want to seek attention. They want to have an expert to solve their problem. And technology is taking a great role in this when it comes to the counseling and consultations.
And there also we can use digital therapeutics or remote consultation. It helps.
Yes.
Many times the patient or the family may not be very happy going to a hospital because they think their neighbors will see them there. Or their friends will see, but remote consultation they are happy.
Yeah.
You've spoken, ma'am, about that people need to speak, they need to talk. And we have Dr. Altaf Chima is a family physician. Dr. Uzair Anwar is also with us. Dr. Uzair Anwar asks you, as a family physician, Anvarji is also a family physician, how important is it to consider the thoughts, the emotions, and the behavior of a patient and a family? The behavior, the emotions of the patient and the family when you are tackling disease. And if you have a patient with difficult emotions, somebody who is angry, somebody who is resigned to death, then how do you motivate them? How do you get them back on track?
Of course, it's a process that it's need to go through it. It cannot be done through one consultation or counseling. It's a step of program that you need to take your patient. Sometimes not alone with your patient, even including their best friends or their family members with them. So these are the things. Basically, I always say that to motivate individuals when it comes to their mental issues or behavior issues, it's you need a set of expertise. It's a holistic approach. It's not an approach by family medicine even alone, but you really need to have that setup. And maybe family physician can diagnose and to understand the main issue, but then they really need to engage with their members from the patient or their colleagues and experts from the field. And I told you it's a holistic approach where the family medicine needs to consider.
What you're saying is right. It's an ongoing process, so you have to continue motivating, and at least don't break the connection. Keep the dialogue going on. So patient may
Yeah.
be angry today, but that is we call it emotional fluidity. So today patient may be angry at you. Tomorrow she will calm down. Day after tomorrow she will get angry at her husband. That is separate matter. So the husband
Yeah.
will handle that. But this is emotional fluidity. The first trick is do not break the connection. Continue the communication, the negotiation, don't stop that. Madam, we are inspired by the hadith as well. We call it hadith in India. Hadith is how they write in English. So the Prophet, peace be upon him, has said that there is a disease for everything in the world except old age. So, sorry, there is a treatment for everything in the world, every disease in the world except old age. So if let us say somebody has a disease, it can be substance abuse, it can be diabetes, we have the treatment because God has said there is a treatment. We just have to find it, and you have to find the right partner to help you. And the family physician will be your guide, your friend. The Urdu word would be rehbar or hamsafar. Hamsafar is in Urdu, in Arabic also, travel companion. So you
Yes.
work together to find the correct path to help.
True, absolutely. And that's the reason when we were doing family medicine, they taught us that we really need to build up a proper rapport between the patient and us. And that's what makes distinguish between us and emergency physician or other specialty
Yes.
physicians.
Yeah. You become part of the family.
Yes, absolutely.
Ma'am, what is coming across from you is a very inclusive, a very welcoming approach, an approach for healthy competition and everybody working for everybody's benefit. So, one last question from the audience is you've spoken of the past, whatever challenges you had. You've spoken of the present, what the government of Dubai is doing, what the UAE government is doing. We've also talked about the future, what opportunities we have. And you've talked about Delhi Health, Dubai Health Authority. We can go and look at that if we want to see how to enter the market as individuals. But as an organization, if there is any other organization outside of UAE, uh, how can they enter the UAE market? How can they reach out to you for public-private partnership for the benefit of everybody?
Sure. I mean, if something to do, say, if a private end or an investors who are looking at Dubai market, now I'm using now my other hat. So basically, what they really need, they can always write to us. Okay, what kind of projects they want to bring to the country, and on what specialities, and then what's their intention and who they are focusing at. So these are the certain things that they really need to write to us, and then we look at it, and it depends. If there is any partnership projects availability, whether it's in technology or infrastructure or any of those, so then government system always is a tendering process. So they always can reach out into the tender, but they need to be registered. So most of the companies who reach out to us, at least they open an office in Dubai, so they can reach to those tender process for certain projects to go into partnership with the government. But if he wants to come in as a private sector, individual, standalone sector, it's a very welcoming market. The process of paperwork in our government is very straightforward, is all digitalized. It's a very it won't take a lot of time, very much friendly as well. As I mentioned, and as I always mention to my investors, do your due diligence, look at the investment guide, look at what opportunity you're looking for, whether it's a startup or it's a technology company or it's a clinic or hospitals or certain things that might add a value to the market. Please go ahead. It's a very straightforward, and if you look at the investment guide, you will have even the journey. What are the journey that you need to go through it if you want to open a hospital or you want to have or obtain your professional license?
Point well taken, and thank you. I think that will add value to everybody who is listening, and people will explore these options.
Yeah, just to add one more point, if you go to DHA's website and look for Investment Guide 2021, you will find it in the website. And if you struggle, you can just Google it. Just write Healthcare Investment Guide Dubai 2021, and you will get the whole PDF file, and you can read it, and it will show you exactly, if you're really interested to come into the buy market, what you require and what you need to do.
Dr. Bandula shares a best practice from his state, from Himachal Pradesh. The government has outsourced diagnostics, including X-ray, CT scan, MRI, and labs, to private players. And they have capped the rates in such a way that they are available to the needy at reasonable rates. So that is one example of a public-private partnership from an Indian state. With this, madam, it's been great having you. 1 hour passed by and we didn't even realize.
Yeah, I know, it's went so
time has
fast.
gone.
And so much interesting topic, honestly speaking.
I am an endocrinologist, madam, but I strongly feel that, like you said, and like Dr. Altaf Chima said, that family medicine is the backbone. It is the spine of our healthcare system. And if we strengthen the family healthcare system, we also strengthen the family. Because, diseases like substance abuse, diabetes, obesity, they are not a disease of the individual. They are disease of the family, of the
Yes,
community. If we strengthen the family, and then when we look at Asian or African lifestyle, the family is our strength. So if we build upon that, we can actually improve the quality of health. We can prevent so many diseases from occurring in our community, in our fellow citizens. So I strongly
absolutely.
believe that. And yes.
Sorry, yes. And in one of my talk, I remember like years back, and it was in IFM, International Family Medicine. I said it, and I actually announced it in the newspaper, that every Emirati family should have one family physicians, because I feel it's a must. I mean, same thing maybe India. Every single family needs to have one Indian family physicians, because it will cater the whole place.
And 99% of the issues will be handled at the family care level. Even if they can't be handled, let us you need a specialist surgery, the family physician will help you navigate the system and reach the right doctor,
Absolutely.
the right surgeon easily.
Exactly. Absolutely.
With this, madam, it's been great having you with us.
Thank
So
you
much
very
of
much.
insight, and like I said, so much of inspiration. So thanks on behalf of everybody, but specifically on behalf of Kriti, my daughter,
Thanks.
Kathy,
Thank you
my
very
niece,
much.
and Kanisha is my younger niece. She's also joined in. She's also saying thank you, madam, for your words of
Thank you.
inspiration.
Thank
And
you very much.
They all want to grow up and become successful like you.
Let's see you in our conference. Maybe we can meet over there.
Certainly.
And welcome to Dubai.
Thank you so much, madam. Madam, we have Faraz with us backstage. Faraz, could you please show certificate of appreciation for Dr. Ibtesam AlBastaki?
Thank you very much.
Madam, thank you. The pleasure is ours, and we are grateful for your time. We value your expertise, your experience, and of course, we are all in awe of your eminence. Thank you, madam.
Thank you very much. Thanks, and thank you for having me this evening. I really enjoyed the talk. Thank you very much.
I'd like to say thank you to everyone who logged in, to Dr. Vipin Madula for your kind words and blessings, sir. Thank you. And let's work together for a healthier, a happier, a more harmonious world. And we can do it together. When we can connect with each other, when we can work in that spirit of collaboration, easily we'll be able to ensure health for ourselves. Thank you so much, madam. Jai UAE. Jai would be, now I don't know, victory to UAE and Jai Hind.
Thanks. Thank you very
madam.
much. Thank you.
Thank you, madam.
Bye-bye.